so important topic, that is malnutrition. So to remember this malnutrition, there are different types of malnutrition: acute malnutrition, chronic malnutrition. Okay, so the parameters of it are, if it is weight for height, then that is a acute malnutrition. If height for age is given, then that is a chronic malnutrition. And if weight for age is given, then it denotes both acute as well as chronic malnutrition. Then there are some age-independent anthropometric indices like the Kanawati-Maclaurin index, Dugdale's index, Rao and Sixx index, Chill-Life ratio. We don't need to remember about their formulas, but the names are important as age-independent anthropometric indices. In the classification of malnutrition, we have the first, that is IAP, that is Indian Academy of Pediatric Classification. So according to this classification, if the weight for age of the child is more than 80%, then that is considered to be normal. Then if it is 60 to 80% of the expected, then, and if the edema is absent, then that is considered to be undernutrition. If it is 60 to 80%, but if edema is present, then that is kwashiorkor. We know the hallmark feature of kwashiorkor is the presence of pot belly or edema. If it is less than 60% and the edema is absent, then that is marasmus. But however, if it is less than 60% and edema is also present, then that is called as marasmic kwashiorkor. So this is the IAP classification. Then according to WHO classification, they have characterized it as moderate and severe. So anything is considered to be moderate malnutrition if it is present in between -2 to -3 standard deviation. It is considered to be severe when it is less than -3 standard deviation. So if the weight for height is between -2 to -3 standard deviation, then what does it mean? So weight for height is a parameter of acute malnutrition. Acute malnutrition denotes wasting. So moderate wasting. If the weight for height is less than -3 standard deviation, then that is called a severe wasting. If height for age is given, the height for age is a parameter for chronic malnutrition. Chronic malnutrition, it denotes stunting. So if the height for age is in between -2 to -3 standard deviation, then that is moderate stunting. If it is less than -3 standard deviation, then it is called a severe stunting. It's simple. Then the next is Wellcome Trust classification. So according to Wellcome Trust classification, again, the weight for age more than 80% is considered to be normal. Then grade 1 malnutrition, grade 2, grade 3 and grade 4. So 71 to 80 is considered to be grade 1, 61 to 70 grade 2, 51 to 60 grade 3, and less than 50% is considered to be grade 4. After that, a very important thing, that is kwashiorkor and marasmus. Now we know basically about all these things, but in brief we'll see. Kwashiorkor is found in 1 to 5 years of age. Marasmus is found in less than 1 year of age. Kwashiorkor is mostly a protein deficiency, while marasmus is protein as well as energy deficiency, that is calorie deficiency, is also found in marasmus. Now here we can, by looking at the features, we can see that in the kwashiorkor there is going to be a pot belly, while in marasmus there is no pot belly, that is no edema is present, no ascites is present in marasmus. Right, the features of face, it looks like an old man like faces is seen. Then there is presence of loose skin folds in the buttock region, the waist region, that gives a baggy pant appearance. Apart from that, there is less amount of subcutaneous fat that is present, and because less amount of subcutaneous fat is present, the muscle wasting is seen to be prominent. However, in kwashiorkor, muscle wasting is present, but however it is not so prominent as in marasmus. Then very important difference between a marasmic and a kwashiorkor child is, a marasmic child, it is active. However, a kwashiorkor child, it is apathic as well as lethargic in nature. Then talking about the skin and hair changes. The skin and hair changes are more common in kwashiorkor child. So what are the skin and hair changes? Here you can see the skin changes. The skin changes over here. This shows flaky paint dermatosis. So flaky paint dermatosis, or it is also called as crazy pigment melanosis. So here we can see there is a different pigmentation over the body. Then over here, this is called as related to hair. So it is related to hair. This is called as the flag sign. That is alternate white and black. Alternate black and white. Sparse hair is there. Easily pluckable hair. So both of them, that is this flaky paint dermatosis as well as flag sign, these are the features of kwashiorkor and not marasmus. This is important. Now after completing this kwashiorkor and marasmus, the next important thing over in this chapter is the severe acute malnutrition. How do we define severe acute malnutrition? So severe acute malnutrition is defined when the weight for height, that is acute malnutrition, is less than 3 standard deviation, that is severe wasting is found, or it is less than 70% of expected. Then mid upper arm circumference it should be less than 11.5 centimeters, and bilateral pitting edema it should be seen. Now, what are the complications of severe acute malnutrition? The complications of severe acute malnutrition, they are given by this mnemonic shielded. It's very common mnemonic. So S stands for sugar. So the amount of blood glucose levels, it is going to be less than 54 milligrams per deciliter. Then H stands for hypothermia, where the body temperature, that is axillary body temperature, falls to less than 35 degrees Celsius. How to manage hypoglycemia? We give dextrose 10%, right? Then I stands for infections. So in case of infections, there are generally specific signs of infections may not be seen, but we have to start the empirical antibiotics. For gram positive we give penicillins, and for gram negative we give aminoglycosides. Now these three things, that is hypoglycemia, hypothermia and infections, they generally occur as a triad. Then EL stands for electrolyte imbalance. So in the electrolyte imbalance, hypomagnesemia as well as hypokalemia, they are very common. Then DE stands for dehydration. So in severe dehydration cases, we are going to give oral resomal. If the child is accepting oral feeds, oral resomal is given. If not, IV fluids can be given. So what is resomal? Resomal is a rehydration solution for malnutrition, right? So it is different from our normal ORS. We know that in normal ORS, that is WHO ORS, the total osmolarity is for 245 milliosmoles per liter. However, in the resomal it is about 310 milliosmoles per liter. The sodium concentration in ORS, it is 70, glucose concentration 70, but however in the resomal the sodium concentration is low, 45, while the glucose concentration can be as high as 125. The potassium in ORS is 20, while in the resomal it is 40 to correct hypokalemia. So these are the important things in resomal. Then the last D stands for the deficiency of micronutrients. So obviously for the deficiency of micronutrients, we are going to supplement the micronutrients by twice the recommended dietary allowance, except iron. Remember, iron should be given only after 1 week. Why? Because that can delay the recovery. It can increase the chances of infections because this iron is not easily absorbed, and this can lead to growth of various bacteria. Now in the home-based management, we can give RUTF, that is ready to use therapeutic food. It's an energy dense food. It is not completely solid in nature, it's semi-solid, more on liquid side, and it is easily digestible and palatable to the child. It consists of about 540 kilocalories of energy and 15 grams of protein. This is important. Then nutritional rehabilitation. In the nutritional rehabilitation, there are two phases: a stabilization phase and a rehabilitation phase. Stabilization phase is during the first week, and rehabilitation phase, it starts after 2 weeks. In the stabilization phase, the goal is to achieve that the child gets 70 kilocalories per kg per day and receives 0.7 grams per kilogram per day of proteins. The goal in rehabilitation phase is that the child achieves 170, to be specific 175 kilocalories per kilogram per day of calories, and 4 to 5 grams of proteins per gram day. Then it consists of a special diet that is called as F75 and F100 diet. F75 diet, it consists of 75 kilocalories and 1 gram protein in 100 ml, while F100 diet, it consists of 100 kilocalories of and 3 grams of protein in 100 ml. Now the refeeding syndrome. So these two phases are basically present so as to avoid the refeeding syndrome. But in case a refeeding syndrome happens, then what is the hallmark feature of refeeding syndrome? That is hypophosphatemia. Then during the discharge, when is the discharge given? When there is an appropriate weight gain, when the child starts to eat on the own, when the mother is confident about it, then only discharge can be given. If the child does not gain weight even on day 4, if there is a reappearance of edema on day 10, or if the child is not able to gain weight of 5 grams per kg per day, then in that conditions discharge is not given, and in these conditions we can look again for our treatment plan. Then there is a Poshan Abhiyan, that is Prime Minister's overarching scheme for nutrition and anemia. So in this, during the first 1000 days of this Abhiyan, it was launched in March 2018. It deals with nutritional problems. So 2% of undernutrition and stunting prevalence should be decreased by 2%, and anemia prevalence should be decreased by 3%. So this is important about this topic, that is malnutrition.